Hi, everyone. Welcome back to Face It with Dr. G. I'm Dr. G, and I'm so excited to have a dear friend and colleague here with me today, Jess Manges. She is from Clearwater. She is the owner and founder of Lux Injectables. And if you don't know her, you should know her. She has such an incredible personality. She's so vibrant. She speaks all over and is really well known for her threads. So we're going to talk all about it, and welcome.
Thank you for having me. I'm excited to do this with you, and I always love seeing you in person, so it's good to catch up on here.
Yeah, it's so awesome. And we are going to dive into a lot of really fun topics. But first, I would love you to share your story about your nursing career and how you got into injectables and then opening your own practice.
Okay, so I started as a nurse. I worked at Tampa General Hospital, and so I grew up in Ohio, and then I moved to Florida to go to University of Tampa for the nursing program. And as I was about to graduate, I'm like, I don't really like nursing. And then I met a professor that told me she had a little med spa. And in that spa, she was doing Botox. And when I heard it could take your wrinkles away and it's something that I could do, I was like, okay, this is what I need to get into. So this is in the infancy of it when they had it at the hospital. They didn't even lock it up because they would use it for things like, bladder spasticity and stuff like that. And so I realized I had to get my nurse practitioner, my master's degree. And so I started pretty much 6 months after I got my nursing and I was working as a nurse. So I had to really grind and I did it. And I worked like 6 or 7 days a week to get it done in about 2.5 years. And then I had to work for people to really get to that place where I felt comfortable opening my practice. So I started working at a chain. There was 12 locations and you didn't get paid very much and I had to take a pay cut actually from what my prior job was. So I worked in dermatology first. So I was a nurse practitioner in dermatology for a couple of years. And while I was trying to find a place that would hire me for aesthetics, but at that point, you really couldn't get a full-time aesthetic job. And then I was able to grow where once I worked at that place that was all aesthetics, I kind of worked at a couple different med spas. And then I finally was like, okay, I can do this. But it was scary. It's always scary to make that leap. And it does cost so much money to run the practice and the amounts that you have to buy. So I just slowly started in like a salon suite
That is
and worked my
awesome.
way up.
I think what you said is really important for people to hear because we have listeners that want to get into aesthetics. You know, they are in it, but they're not fully in it. And it's really hard not only to start part time, but to find a place that is willing to take you part time because it's true. You have to be able to survive and live. And to leave a hospital job or to leave a private dermatology practice, you're going to take a pay cut. But what I tell people is this is a residency program. You're never going to learn so much at one time. Your learning curve is going to be straight up, and that's what is going to set you up for success. But you have to be willing to take the leap, and uh, no risk, no reward, right? But it's hard.
Exactly. It's always scary, but it's exciting. My family was at that point not on board. And so they were like, what are you doing? You're leaving a hospital job and you have a 401k and you get a consistent income. And so I had all these factors of people kind of telling me not to do it, but there was just something inside of me that I loved the artistic part of it. And that's really what drew me to it. So I just knew that's where I just had to keep on going. And of course, I ended up loving it.
Yeah. So, how long did you work in a practice before opening your own?
I worked at a practice. So I first started at that chain. So they had 12 locations. They actually put them in malls. So one was at Tampa International Mall. And so I worked there and then I worked at a bigger med spa So at one point, I had to work at two or three to make a full time income. And that's where I had to really grind. That was difficult to work at multiple places. And so I did that for probably 5 years.
Wow. And what was kind of the turning point? Did you always know you were wanting to start your own, or what changed to open your own from working as a practice?
I never wanted to start my own business. That was something that I just was completely scared of. I knew it was going to be a lot of work. It was every person I was working for. It just wasn't, the energy that I wanted. It wasn't how I wanted to do things. And COVID happened, so it finally gave me that push. Like, really, you couldn't depend on anybody at that point, no matter if you did work at a hospital or a private practice. So it's just like, why not do it at this time? And who I was working for was getting all my patients' information. And I realized at that point I was bringing in pretty much like 90% of the patients from my Instagram, because I was able to start the Instagram at that one place that I worked at that was chain. And so I built it up over the years, and also I kind of felt like that was a threat to the practices I was working at,
Hmm.
and that was difficult navigating that because that was kind of like in the infancy of having your own Instagram or your own brand under another company.
Yeah. Yeah. And so that was almost like you didn't see it happening, but you created your own brand within one, which is, that's a luxury that you had, which is, yeah, I agree. You can't do that at a lot of places. Um, but good for you. And then you branched off and you started Lux Injectables. How many years ago now?
So it's been 5.
That is awesome. So 5 years, it's a big turning point. Um, when
It
you
really
start,
is.
yeah, it's that's you're like, I don't even know where to start. Um, so when you opened for people that are looking to do this or thinking about it, um, I guess tell me, how did you do it? Maybe something that you wish you had done differently, and talk about your team that you have now.
I started with getting a medical assistant and a manager. I did know I needed somebody to help me on that side so I could concentrate on seeing the patients and what I did best. And so that really did help, is getting somebody that had a background in that. So she had worked in aesthetics prior and also helped run her husband's company. So it was an international furniture business. So she was just used to doing all different things. And then getting an assistant that was in the room with me, because you're able to see more patients. So I learned quickly that I did need these people to help me. And I actually am still the only practitioner. So I'm very unique in that way, because all of my friends have hired people at this point, and I've stayed a solo practitioner with a manager, and then I have multiple assistants that are helping me.
Wow, that's awesome. So are you working every single day of the week?
Not necessarily. And as you know, I train and I speak at conferences. So depending on my schedule, I may be out half the week. I may be traveling or going on vacation with my family. I may be in all week. And so the schedule does really change. And the patients are okay with that, and they come when I'm here.
So when you're away, how do you deal with that, the revenue and, when you get paid for speaking and training, does that equal what would have made in the office for those days?
It does not equal what I can make in the office, and it never does, but it's part of keeping up with continuing my education, staying on top of all the latest techniques and technology. So I do feel like it's really important to do it. I do think that we need to find a healthy balance, and that's what I've really been trying to do, because as you know, we tend to, as overachievers, put too much on our plate. And I only have one kid, but I know you have kids as well.
Mhm.
And It's a lot, but it's important to do these trainings and keep up with it.
Yeah. So who do you speak and train for mostly?
I do a lot of thread training since that is something that I do on a daily basis with my patients. So I do multiple patients a day. So I train for Mint and Maricue and Maricue with Benev. And then I also am a Revance trainer as well as a MERS trainer and Toscani.
In Tuscany. That's awesome. And for those of us listening, I guess, that don't know much about trainings, tell the consumer or the client or the patient, um, what do you do in these trainings? Are you training patients? Are you training injectors? What do you do?
I am training. So if it's at my office, we'll have a group of injectors come to the office. They can be doctors, nurse practitioners, and they come in and it's a hands-on. Sometimes I'm doing demo trainings. It could be at a conference where I am speaking and talking about different patients I'm seeing, and then that's more of a PowerPoint presentation that we're doing and for a larger audience.
That's awesome. Yeah, and you're so good at it, and I know you love it, which I think that's really important to obviously it's a sacrifice and a revenue cut or whatever it is, and being a business owner, you have to take that into consideration. But like you said, it's good for community building as well and education, continuing your knowledge because we always learn. Even if we're the trainer, I feel
Hmm.
you learn a lot from the questions that you're asked. Um, so let's go into threads because that's how you really exploded on Instagram and TikTok, but also just probably with your patients. I think the first time I came across you was your eyebrow thread lifts. It was the cat eye.
Yes.
So talk to us about how you branded that, what your special technique is.
At that point on Instagram, I really don't think anybody was, or many people were showing threads, and at that point, brow threads. And it's something that I just really took to and I love doing. And so once I went to a symposium at Dolce Vita, and then he introduced me to Mint Thread. So getting threads that are molded and the way that they lift were much better than the prior threads I was using. So I was really seeing a change in the results, as well as I started using threads with a combination of treatments. And that's when I started getting patients back after 1, 2 years of doing threads. And so I was like, there's definitely a change when I use these in combination with everything else I'm doing. And the brow threads, I do think a lot of people shy away from just because they are a little bit more challenging to do, and patients can have a little bit more discomfort time after. And so I think that it was something that was appealing to people to look at on Instagram because as you're like pulling the threads, it just looks like it's eye catching, like that cat eye
Mm,
look. And everybody would think like, oh, am I going to have this cat eye? And it's like, no, it's going to settle. It's going to look natural. It's not a surgical thing, but it does get people to look at it. And I just called it like the JJ brow lift. So I just tried to brand myself and start with something that I knew would kind of catch people's eye because
yeah,
you
and
have
you're
to
right
be
on.
able to separate yourself from all these people doing this.
Hmm. So when you do brow lifts, brow thread lifts, are you inserting the thread and going up to the hairline, or do you do the other way, or both?
So I did start with traditional vectors. And so I first started Euro threads and were taught to start in the hairline and go down. And then I used Nova thread. So I would do traditional vectors, kind of doing a V pattern to lift that way. And then I started doing a lot of reverse vectors when I started using Mint threads. And so they had the line where they had a fixating thread, so it's multi-directional, and so it really helped with the hold on that, as well as Mint carries petite thread, so it's a shorter thread, so it has a lot more of the anchoring barb on it, and so you can get a better lift on it as well, and it's just easier to use in that area. And so now I typically do more reverse threads where I'm coming from the lateral portion of the brow and then going up into the scalp line and kind of like at the peak of your brow too. And just looking at the patient, seeing if they have any asymmetry and seeing if I need to add more on one side versus the other, and just educating them on also keeping up with your neurotoxins in that area.
Yeah, I was going to say, what combo treatment are you using in the forehead? And I'm assuming it's mostly, you're not doing injectable fillers in the forehead, I'm assuming. Um,
Not on many people, but I think Daxxify is great. I love it for the ability with the peptide. So I do feel like I noticed more improvement to the skin as well with that. And just keeping patients consistent on it, because you're not going to have as much muscle activity, so your threads will last longer.
yeah, yeah, I totally agree. And I think that goes for any injectable biostimulator, filler, or thread that you always combine with neurotoxin, because when you're restructuring the face in whatever way and you're not relaxing the muscles that are pulling on that new product you've placed and the new structure in your face, it's not that the result looks bad, but you're just not getting, I think, the longevity of the result in
It's
general.
true. So it's just kind of educating them. I know it's like extra. They're already spent a couple $1,000s, and you're like,
Hmm.
okay, now you need to add this in. So I do feel like it is such an upkeep to what we do, but it's partly educating them. Like, if you want to have abs or be fit, you have to go to the gym often. And when
Yeah,
patients ask, like, what are you doing? And it's like explaining to them, keeping up with all these different modalities.
totally. And sometimes I use this phrase today because people come to your office to be told what they should do, right? And then like, oh, it's expensive, or oh, it's this, or is that. I'm like, I get it. I was like, you can keep it. You can keep your sun damage. You can keep all this stuff, but I'm giving you the options that I think you should take advantage of because they work. And so then it almost takes the pressure off. It's like, I'm not here to force you to do anything, but you're in the office. And so these are your options. And it's makes it a little bit lighter because, yeah, it's an investment and it's a continuous investment. It's not just one time. Um, Okay, so talk about mid-face threads. So who's the perfect candidate for mid-face threads? And yeah, we'll start with that.
Mid face threads, we're talking like cheeks, and I always kind of start with cheeks and then do a little bit into the lower face as well. But really, even starting in your 20s and up, I've had patients in their 20s because they either genetically didn't have a lot of fat pad in their cheek and they had more of a heavier nasolabial folds, and so it just really depends on the patient. We have a lot of patients losing weight now. And so this is a great time to use threads to get that lift on the fat pad and also get the stimulation of collagen.
Yeah. Is there a candidate, let's say you have a younger patient, let's say in their 40s, mid 40s, that has thicker skin that feels heavy, but then you also have a 70-year-old patient that has tissue paper, really thin skin, very little collagen. Would either of those be good, bad? Because obviously in the middle is kind of your perfect candidate, but would you do it on those patients?
The tissue paper skin in the older patient, you have to be careful with, because they're not going to get as good of a result. You have to be careful with how thin the skin is. And that's where, even if somebody is, say, in their 50s and they do need a biostimulator first because they do have such thin skin and have a lot of fat loss, I will do Sculptra or Hyperdilute Radius first, and then I will do the threads on them once I build up that collagen.
Oh, interesting. So you'll do it because I love mixing those treatments. Sometimes I'll do threads and then inject sculpture after. So you'll build the collagen first with those products and then use threads. How do you feel? Because obviously that collagen, yes, it's the right type of collagen, but types one and three, and but it's not necessarily the same parallel, beautiful normal array as our normal natural collagen. So
Mhm.
do you feel inserting threads after the fact is a little bit more challenging, or do you think it's okay?
I do feel when I am doing patients that I have done sculpture on or hyperdilute radius or they had Morpheus or they had a facelift, it is going to be a little bit harder to insert the threads just because
Mhm.
it does thicken up the skin. That's what we want it to do. And that's why threads can be a little bit more challenging than sometimes people think because everybody is so different. Every patient is different when you're placing them.
Yeah. Yeah, I agree. What do you think? Because it's interesting. Well, what do you think about PRF or PDRN? All of these injectable growth factor products in assisting in threads and the results. Do you use those?
I do. I think they're great. I've been using PRF for a long time. I've been doing it personally for my under eyes, and I do it at least 2 times a year. I think as long as you're somebody who's healthy, takes care of themselves, and you're in that right age range, using your own body's growth factors is the best. And I know we also have, PDGF, which is a little controversial right now. And
Yes.
that's also an option if we do want to use, growth factors from another source.
Yeah, and you use those why, obviously, well, you tell me why you use those.
Older patients that really just, you're not going to get much off of their PRF.
Yeah, exactly. And it's for, they're anti-inflammatory, they help with tissue regeneration, healing, collagen stimulation, all of those. So I agree. I think they're incredible. I know there's a lot of controversy on should they be injected or not, but we're just really not going to get into that right now.
Exactly.
So when you're talking about, so we talked about mid face, and then when you go to the lower face, it can be obviously very complex and has to do with mid face structure as well as obviously what the lower face looks like directly. How do you address, a saggy neck with hanging skin?
That's where you definitely want to still pick up the mid to low face. And then, because they'll come in and be like, why can't you just do my neck threads? And why do I have to do my cheeks or my lower face? Because all of this tissue is interconnected. So I just discussed with them that we have to pick up everything. And then I go underneath the neck to pick up that skin as well. And so it's just a process of I divide it, I call it a 1, 2, or 3 point lift. So a 3 point lift is going to be my full lift where I'm including the neck area as well.
Yeah, that's awesome. And you'll do threads along the jawline, and then will you do any threads in the actual neck?
I will. So depending on like how much laxity you see when they're bending down in their tissue, I do come down like a V pattern to catch that. And that's where I'll do traditional vectors and then I'll look and see do I have to come in and also add some reverse vectors if there is still some tissue I have to pick up, or do I have to add in hyperdilute radius to the neck area? And so I do them on the same day as well. If that patient's skin isn't too thin, I will typically thread lift the patient and then I'll go in and do the volume replacement
In the same visit.
in the same visit. Yes.
That's awesome. And do you charge per area or do you charge per product?
Typically it's per area. It's not like per thread because I don't want them, being like, oh, I
Yeah.
want 4 threads. Or usually my patients are pretty good. They kind of know my system. And it's with filler, I do by syringe. And so I know everyone's different with that. They may do
Yeah.
packages or jawline package, but I still do by syringe.
Yeah. That's interesting. And it's whatever works for you and your practice, obviously. So for follow up, what do you tell your patients to expect after the fact? How long will they last? I don't love that phrase because I think it's just so, I don't know, involved.
Hmm.
But how do you direct them afterwards and how long they will last, et cetera? And when do you see them back?
I tell patients because I've been doing them, for so long that I've been seeing patients for 5 years. So they usually come back around once a year, give or take. Sometimes it's 2 years. Sometimes they have to come back in 6 months because they do start noticing some laxity, especially now with everybody losing weight. We
Hmm.
do have to see them a little bit more often because of the GLP ones.
Yeah. Um, do you have them do like radio frequency microneedling or anything after them to help stimulate collagen as well?
I do. So I have the Sulfurm. I
Yes,
have,
I love that.
you know, I love the Sulfurm. So that's great to do just to continue the collagen production and also keep up with the, facial rejuvenation. It helps with also pigmentation, redness. And then I do the Ativa. So Ativa is radio frequency with subdermal heat, and that is really good for just kind of like tightening everything up, shrink wrapping the skin. So I might have them do that 4 to 6 months after the threads. And I like the Ativa because I can also do eyelid tightening and under eye and the neck, which are harder areas.
Yeah. Yeah, that's awesome because I do think that it helps significantly, and I don't do nearly as many threads as you do. Um, but I think when you do combination treatments and have them come back in a couple weeks to do radiofrequency microneedling, it just everything gets better. Um,
Mm-hmm.
what kind of complications have you seen with threads, and how do you deal with them?
Complications can be annoying with threads, and that's where I think some people, if they're newer with threads, can kind of get scared to do them because of the complications. And
Hmm.
so I do so many. I have very minimal complications, but when they do happen, they can be annoying. And it can be anything from like a nerve irritation from where that thread is sitting on, from swelling. So usually once the swelling goes down, that nerve irritation should subside.
Typically, I find it's
But
at the end of the thread, the very end. It just is irritating right by the mouth, especially with cheeks and yeah.
yes, so because of that movement of the muscle so much, it could migrate, especially where the end of the tip is, and come up a little bit. And you'll
Hmm.
know if it looks like a pimple that it's close enough to the surface for you to kind of take like an 18 gauge and pull it out. But if you can't really see it to that point, then you don't want to go around digging for it.
Yeah, oh, no, I totally agree. And I think also ultrasound could be really great for threads, and just also just patient kind of appeasing them, letting them know it's swelling, there's a little fluid accumulation around the thread. It's totally fine. It'll settle, those types of things. Last year at Face It, I did live threads on stage with ultrasound guidance, and it was awesome. It was really good. And I think it'll just
Yes.
allow people that are scared to get into them. Because when you're timid, you're not going to do them as much, and you obviously have to do them to get really, really great and
Hmm.
proficient. So that was fun. Um, have you ever had to pull one out of a face? Because I know that is something that can happen right after
I
inserting, I guess.
have. Yeah, so if I feel like after inserting it, there was just something with, because sometimes it can get stuck on another thread while you're inserting it, and you could feel like it pulls down on that thread.
Mm,
So it kind of coils it. I will just yank it out immediately so I don't have to deal with it, and that's easy. So it's not that hard to do that, but it's once you clip it that can get
yeah,
difficult. And so if
yeah,
you think there's going to be like any issue with that thread that you place, like just something about it, or you kind of went too superficial, I just say pull it out right then.
I agree. And I'll do both sides without clipping and see how the patient's doing, seeing if there's any pain, all of that, just in case we have to remove it right away. But the
That's
patient's numb; they
smart.
don't really feel it; it just comes right out. But
Yeah. Yeah,
we do have people
it's not
scared.
really that bad.
Um, yeah, that's awesome. And no other complications or things that patients should be worried about, right?
Those are really the biggest things that I see happen. I mean, sometimes at the insertion site, there could be a little nodule, and again, from movement and mobility. I've had that happen maybe once or twice, and it did go down, and I had to maybe inject one time with Kenalog into
Hmm.
that site. But those are pretty much the worst things I've seen. Anything that you have had happen?
No, no, knock on wood. I mean, I've had great success with them. I think patient selection for me is very important, and patient expectations, because if there's most patients will do them after they've done biostimulators and they want that lift before they go get a facelift.
Hmm.
But you have to be careful, and it's not a facelift. And if they think it is going to be one, or even remotely close, they're going to be set up for dissatisfaction essentially. So that's been a big thing. And once you're clear with them, I think it's great. I also do a lot of smooth threads. Do you do smooth threads as well?
I do. I love them.
Yeah, I love them. I love them in the combination with radio frequency microneedling. Just a little bit of that lateral lift with tox around the eyebrows, the lower face, the neck. I think they're great. Um, you know, I think people come to you because they know you do threads and they're excited. But do you have patients that are just like, I don't want to thread in my face. What is this? Do you show it to them and show them what it looks like? Because I think that's also, people just don't like the idea of it.
Yes, I do have patients that come see me and they'll be like, "Okay, I know you're known for threads, but I don't want threads. I just want
Yeah.
facial balancing." And I'm like, "Okay, don't worry about it. We have many other options that we can do." And there's a lot of things that people hear on social media too, or, surgeons or dermatologists saying they don't work. So all these little things that can get in
Yeah.
people's heads.
Everybody has an opinion, and everybody will always have an opinion. And everyone has the right to make their own decisions. So it's like, okay, listen to it or don't listen to it. Let's not get all our panties in a wad. There's no reason. Um,
Exactly. And you can always start them on, like I say, we can always do just like a couple or just your cheeks, just something to start you so you can see, and then we can add more. And that's why I really do love threads too, because they are very versatile. So they're just as
mhm,
versatile as doing filler. And as far as the natural aspect or looking natural, I've never done a thread lift that didn't look natural because it's just 100% just lifting your own tissue and
mhm.
collagen. And so once I explain that to patients too, they do like the idea of that.
Yeah, I totally agree. I love that. Okay, so let's go to maybe, I know I mentioned this before we started, but something that you, I guess, would have done differently in your career in aesthetics. Now that you look back, and the field is so incredibly different than even 5 years ago. I guess, what would you have done different in your career? And then we'll go to the next one.
Wow. I mean, it did take me a while. I feel like some people do go on their own or open their business a lot quicker than it took me to finally feel like I needed that push to, but that might just be my personality. I know you have two practices.
We have three
Is
now.
Oh, you have three now. Okay.
We have
So
three
that's
now.
something that I think is hard for me is to make that next jump to like what's next? What more can I do? So nothing that I wish I did differently, but maybe I could have probably tried to expand and get another injector or somebody to help when I am gone because it's not like I can't do that at any point, but I do think there's certain things that hold me back because of my personality and things I don't like to manage.
And that's honestly very powerful because you know what you want, you know how you function, and you're obviously, you want like to control your situation. I think for you, just hearing your story, what would relieve you as someone who can do the skin health treatments like microneedling and laser and all that while you're doing the threads, um,
Hmm.
and focus your time more on the injectables versus the skin health. But I feel it's people management and making sure everyone's happy and creating a culture. And I don't know, sometimes it's nice to be alone, but also I can't imagine not being surrounded by my team every day. I don't know what I would do. So,
Yes, no, it's amazing what you built because I
oh,
do know even just with me and my small team how much work it takes. And so it is something that I do tell people as a trainer and educator that you have to find what your passion is. Everyone is different and you're going to have a different path, and that's okay. And I do think that took me a little bit of time to feel okay with.
Yeah. You're living your life. You're not living someone else's life. And what makes you happy is different than what makes other people happy. And that's you do you, literally and figuratively. Um, what is maybe the biggest mistake you ever made? I don't know.
The biggest mistake, well, the biggest mistake is saying yes to things that I didn't need to buy. And so, as we know, we always have people bombarding us with, the reps coming in and showing us the newest laser or putting in this large amount so you can go to this trip where you could have paid for that and the house or payment for something. So, and they'll catch me on days when I'm really tired and I'm just kind of like, okay, yes. So it's not just maybe one order, one thing that I've done, but there's certain times that I didn't need to place these large orders, or I bought a machine I didn't really need to buy because I had one that was very similar to it. I also think it's hard to find the right people to help you as far as doing your website, your SEO, marketing. And so you're going to have these people that are telling you, I can do this, this, and this for you. And it sounds amazing until you have to go forward and start working with them. And then you realize that it's another person that you're going to have to stay on top of and babysit. So I do think I've made some mistakes in who I've picked to help me.
Yeah. And I think, you know, every decision has a consequence and something positive, obviously a positive outcome, but you learn from all of those. And then you realize the next person, obviously, we're not going to choose the same type of individual or company or whatever it is. So I try as a business owner to look at all of maybe the blessings in disguise.
Yes, I do learn a lot from these things, and it's something as simple as maybe like changing your medical record system or
Yeah.
your checkout system. And I had a big issue with that. Like I changed from Square to Clover, and Clover held my money for months.
Wow.
So, yes,
That's not okay. And I know you're,
exactly.
um, you know, working with Moxie in some way, shape, or form. I know you're big supporters of them, a big supporter of them. And there's all these new, very exciting technologies and platforms that are coming out when it comes to EMR systems and integrating everything together, HR and payroll and ordering, all of that. So I think there's a lot of exciting stuff that I know both of us have the opportunities to be kind of at the forefront of, which is awesome because
Hmm.
let's make it the way we want it.
What are you most excited for?
What am I most excited for?
Yeah.
Um, in general, I'm excited. I think for a while I was caught up in this space in a way that distracted me from my true goals and passions and the people around me. And that was out in the industry and traveling and speaking, which I love so much. But I'm
Hmm.
excited for obviously the growth of GFace MD and just to be boots on the ground and to grow my people. And I took a little bit of a break from that kind of public speaking and traveling, but just to get back in a little bit more, but very small, tiptoe into it, and balance everything better than I have in the past, even though I don't really know what balance is. It's all ebbs and flows. I think that's
Hmm.
most exciting. And I am thinking about our fourth location, and do we go to Florida somewhere? Um, or
Everybody wants to go to Florida.
or
But it
do we
is
do
great
another
there.
here? Yeah. What?
Are your other locations by you like within an hour? I heard like always start one at least close to you.
Yeah.
Your
So
first one.
they're around an hour from each other. The one on the Cape, on Cape Cod, is probably a little closer to an hour and a half from the main one. And Wellesley is a suburb right outside of Boston. It's like 25 minutes from the city, so it's not far at all. It's one of the first suburbs. And Andover's north and Cape Cod is south. So we've kind of captured those two areas, but then we're
Mhm.
not right in Boston. So the next idea is okay, let's go right in Boston, but the real estate is crazy.
That's true.
So,
And
but I don't
so, do
know.
you work at these different offices, or you only work at one and then hire people at the others?
Yeah, so I have G-Face now has 9 injectors, and at the beginning there was the whole goal is to have team members at each location, but they had to come to Wellesley to the main one to train first, and we have a whole system for training, and then we kind of let them fly away to their locations, and that's how we built main staff at each location, and then we have a couple nurses that still rotate just between two, not three. But for a while, some of our injectors were going between 3 locations, which was crazy. And it just shows the
Wow.
dedication and everything. Um, but I, myself personally, I'm at Wellesley for 2 days a week, and then I go to Andover for 2 days a week, and then I'm in the Cape only one day a month now, which is crazy. So,
And do you like that variety and change?
uh, less and less.
Okay.
I mean, I want to be at all the locations and I love them. And I've had people comment, aren't you worried about what's happening at the other offices and all that? I'm like, no, because the management team, they all kind of take care of all of it. They run
Hmm.
like well-oiled machines now. So I think if there were endless funds, I would just keep popping open offices. I love the projects, but
Oh,
that's not the
okay. You like, did you do build outs on all of them?
case. But now I have a decorator that I've had, a designer for years, and she does everything from Tampa, actually. She does everything remote. She's amazing. But we have such a brand kind of identity now that it's very easy to make them. You just have to have the backing to do it. And I'm still privately owned. So we'll see.
Wow, that's amazing. That's what
We'll
you
see.
need to do a class on, is opening the multiple practices.
Yeah. I mean, but you have to love it. Like you said, it's through all of this, I'm like, what actually brings me joy? Yeah, seeing patients brings me joy. Having my team happy and thriving brings me a lot of joy, but challenging myself to open up new offices brings me the most joy, I think, which is very weird.
No, I mean it's great. It's that's why we're all so different.
Yeah. Yeah. Well, this has been so awesome. I think we've been on here like an hour
Yes.
already. But thank you for taking the time. I know you're super slammed and time is so important, and it was good to see you as always.
Yes, it was good to see you too, and thank you for having me. You can find me at Injector Jess and at Lux Injectables. I also have a Patreon, Injector Jess, and contact at luxinjectables.com if you have any questions.
So good. And for all of you, like, watch, subscribe, and we'll see you again next time.